So for us, we get our DCs in Hawaii. Um, so previous to a few years ago, our company had been, Amerisource Bergen customers for 20 something years. Um, and they pretty much only offer once a week delivery. So that presents a lot of challenges. One being that we have to keep a higher level of inventory on hand. So typically for most drugs, we have to keep at least a month on hand. Fast movers, we try to keep at least 2 months on hand because
Wow.
are there are some weeks where something might happen that might delay a flight, or maybe our packages didn't make it on the flight, and so now we're not going to get any deliveries for that week. So you gotta have enough inventory on hand to sustain. Also, we have to choose. Our purchasing guys have to choose between air freight and barge freight. So if something is heavy, it's going to be expensive on air freight.
Right.
So usually the big, bulky, heavy stuff they'll order by barge. But if it's coming by barge, it's going to take 4 to 5 weeks to get here. So, for example, our 1,000 count metformin bottles, they're big and heavy, and we'll order 15, 20 at a time, and so typically they'll order those by barge, and especially since that one's a fast mover, we can kind of time it to basically
Mm-hmm.
order a set amount every 2 weeks because we order barge orders every 2 weeks and air every week. And so it's a little difficult sometimes trying to parse through what you should air order, what you should freight order.